Breast enhancement surgery is the most popular plastic surgery procedure. Making the decision to have it is something that should involve careful thought and doing your homework. Dr. Sergio Maggi of Austin Plastic Surgery Center is here along with Tricia Rollman and Kathy Chase to talk more about that. Thank y'all for being here this morning.
Thank you.
And you brought some examples of implants and the saline and the gel. This is something you're going to help each patient choose individually.
Yes.
And also important, safety, which we were talking about how that is just paramount with your practice, right?
Of course, yes.
And your team works tightly together to create a safe atmosphere.
I think that's how you ensure safety, is by a team approach and quality at all levels and consistency at all levels. So when it comes to surgery, we take it very seriously. I've always been a proponent of satisfying the result or achieving the goals, but always with an understanding that it's got to be done safely and it's got to be done appropriately for the long term, not just a bubblegum surgery. It looks great for a while, 6 months, a year later, you wish you wouldn't have done it. That's a mistake. And I feel the dynamic is an understanding, also a focus on the specific goals that individual has and trying to meet those goals in the most precise way. That's what we do.
Right.
Yeah.
And Kathy, you're in surgery with Dr. Maggi, and you deal a lot with the patients right before. They've made the decision, they're going in, they want to do it, but there's got to be anxiety. How do you ease those fears and answer those questions for them?
I just answer everything that they could possibly imagine beforehand, before we even get to the surgery center. About 2 weeks prior, we do our history and physical, and I go over everything from what to expect to what to expect after surgery, during surgery, before surgery, pain levels. If there is pain, usually there's not any pain associated with the procedures that we do. I try to answer everything that they could think of.
Everything.
Everything.
That's great. And Tricia, you are a patient as well as in the staff as well, and you can speak to the recovery process and dealing with recovery as a patient and as a nurse. Tell me about how you help in post-op.
Yes, and I actually do. I'm a certified medical assistant, clinical assistant to Dr. Maggi. And yes, I've been both patient and worked for him for several years, so I have the background of knowing, you know, about the procedure, having gone through it multiple times with him and other physicians. And it's just an entirely different way of doing things at Austin Plastic Surgery Center. Dr. Maggi's approach, again, is the main concern is safety. You know, safety, being knowledgeable, going into what the surgery is, what it entails. The aftercare, that's exactly what I do. That's exactly what I take care of. Patients are in constant communication with us. All questions are answered within a reasonable amount of time. They have our phone numbers. There's always a way for them to feel that they're connected at every point for whatever reason.
That safety gives them confidence in their decision to work with you. And I know you guys are a very tight-knit group, and that comes through to your patients too. They feel like everybody knows what the other is doing, and that's a really good feeling of security for them as well, right?
Right. Well, that's just a testament to our dynamic, that it's not just happenstance or you do what you do, I do what I do. No, we are in unison. In terms of pain, it's more soreness and discomfort. When it comes to breast, the concerns are always, am I going to need pain pumps? Am I going to have a month at home? Am I going to be able to be active? And the answers are the best way to describe, for example, breast augmentation is when the implant goes under the muscle. Just think of having done lots of push-ups in gym class, and that soreness you feel when you reach, that's what you're going to feel. It won't be the kind of pain that requires a lot of pills, a lot of narcotics, which I'm very try to be a purist about. Minimal medications. Get off of those as soon as you can. It's really about movement and massaging and understanding this is your soreness, and soreness, like the soreness you get in the gym.
Thank you so much for y'all for being here today, for all the information. We appreciate it.
Thank you.
And go to drmaggi.com to learn more about their procedures, meet the team, and see their private surgery center, or to book a consultation.